Why sex therapy? Josh Spurlock, certified sex therapist, here to answer your sex therapy questions. So why does sex therapy even exist? Well, the answer to that is the aspects and dynamics of our sexual experience are very nuanced. And traditional therapists aren't trained to troubleshoot and overcome the challenges that we experience in our sex life. It's not a standard part of therapy training. And so if you go to a graduate school or doctoral program in psychology, in therapy, in mental health, master's in counseling, they're not going to have but maybe one course on human sexuality. And it's going to be a survey course around sexual functioning. It's not going to get into how to do therapy to help treat sexual difficulties. This is also true in med school. And so your physician going to have anatomy and physiology that covers how the body functions and works in terms of sexual response. But sex therapy is much more nuanced than that. It's not just anatomy and physiology. There's emotions, there's the whole psychology of relationship and connectedness, and there's all of our history and story that influence sexual response. And none of that is part of physicians' training. And so as a medical doctor, they understand the body parts and how they're supposed to work and can troubleshoot the medical side of that, but they're not equipped to do sex therapy. And so sex therapists and sex therapy exists as a specialization because it's a very important part of life and relationship and satisfaction in life. And this is the specialty where we know how to overcome the challenges that people face in it. So why sex therapy? Because you matter, because your sexuality and your experience in your sexuality matters. And we're the folks to come alongside you and help you troubleshoot the challenges that you face over time. You've got questions, we've got answers. Leave your questions in the comments and we'll make some more videos.